Norman Swan, who this week took out the gold medal for this beautifully executed pirouette on live television.
Let's start with Mike Pompeo and the president there saying that, or in Mike Pompeo's words, there's enormous evidence this virus started in a Wuhan lab. What do you make of that?
Well, I've looked into this, and other journalists have looked into this as well as scientists, and there really is very little evidence. It's on the outer bounds of possibility, but really so unlikely that you could say definitely that it's not the case.
And there's indications that virologists in the Wuhan Institute got sick in November with an illness. So there are increasing signs that the Institute of Virology may well be the source.
So why the change of heart? Well, before it was Donald Trump pushing this theory, which meant it must be false. But now Joe Biden has ordered an investigation, so it must be true. It just shows Swan, like almost everyone else at the ABC, regards anything conservative governments do with suspicion. This week he tweeted, "Hotel quarantine in New South Wales is not safe."
But compare that to what he said in June last year on the verge of Victoria's second wave. Quote, "A real shame it's got to this. Victoria seems to have done everything right."
What?
Seems to have done everything right. I don't recall that being the finding of the Victorian hotel quarantine inquiry. 2 days after that tweet, Swan was still ambivalent about the situation in Victoria.
Brendan Murphy wasn't saying it. He didn't think we're there yet. But do you fear we're on the edge of a second wave of COVID-19 infections?
No, I don't think you can call that yet. The cases are still small in Victoria.
What followed resulted in Victoria recording 90% of COVID deaths in Australia. And last year, Swan stubbornly refused to recognise the Berejiklian government's management of the crisis, particularly its excellent contact tracing system.
And what about this idea that New South Wales is the gold standard of how it's dealt with it all?
New South Wales isn't the gold standard. New South Wales is lucky.
Just luck, apparently. Now, compare this to what he said in October last year about Victoria when people were finally allowed to emerge from their homes after being under house arrest for months on end.
I mean, Victoria's done an amazing job. I can't see anywhere in the world that's actually done as well as Victoria.
During the Northern Beaches outbreak in Sydney last December, Swan took issue with the New South Wales government's incremental approach of managing the crisis. Here was his solution.
So the precautionary principle would be locking down Greater Sydney and really holding that for about 2 weeks.
That's right. Swan demanded the government lock down a city of nearly 6 million people. This was his prediction about the state of contact tracing in New South Wales.
It's to the great credit of everybody, including New South Wales, that they've got that system going, but it won't take long for that to be overwhelmed.
Horror upon horror, the Berejiklian government rejected his gratuitous advice. And guess what resulted only a month after Swan's prediction that contact tracing would be overwhelmed in New South Wales?
From tomorrow, COVID restrictions will ease for Sydney-siders, with health officials confident the Northern Beaches cluster is over.
There's that New South Wales good luck again, I suppose. Remember Norman Swan's prediction in March last year that case numbers would hit 80,000 that month? Just to put that in perspective, we have, over a year later, only 30,000.
The same month, Swan appeared on Q&A to make this alarmist prediction.
So the predictions at the moment, if this hockey stick doesn't change that much, is that we'll be out of ICU beds in New South Wales. Victoria will be behind that by April 10th. And in that case, ICU physicians will be faced with some very difficult decisions.
Paul Kelly, do you agree that our hospitals will reach capacity by around April 10?
No, I don't.
Amazingly, it was the epidemiologist and chief medical officer Paul Kelly who was right, as opposed to the medicine graduate with a master's in second guessing who once moonlighted as the medical consultant on The Biggest Loser.
When Swan appeared on ABC's 7:30 in December last year, he was advocating a caution and slow approach about vaccine approval.
The news about this Pfizer vaccine potentially rolling out as soon as next week seems to have come very fast. How should we see this? As a game changer, or are there still concerns?
By the time we get approval in a slower and more deliberate way, we will have the experience of probably millions of British people and Americans having had this vaccine. We'll learn a lot just by waiting 8 or 9 weeks.
But this was Swan tweeting less than 4 weeks later. He said the best Christmas present the federal government can give is, if they don't want more lockdown, is to get on their bikes and bring in a decent number of Pfizer and Moderna doses right now to help get the clusters under control. Brewing in Queensland? Hope not. Are we really in this together?
All over the shop. Think Tim Flannery with a stethoscope. Yet Swan had the hide to tweet last month that politics are now so toxic that the community is confused and losing trust. Trust got us through 2020. What's needed is a cathartic reset. Ooh, no spin. The facts, even if they're unpalatable, should be on the table, not via News Limited.
Oh.
Talk about a fragile ego. It's not News Corp's fault for reopening, for reporting your numerous errors and wild predictions, Norman Swan. You told Sydney Morning Herald last year, quote, "I don't want to be the national spokesperson for coronavirus. My job is to hold the government to account." Well, you certainly act like you want to be the national spokesman for COVID, but you get very antsy when you are held to account. What was it that you said early last year?
One of the problems that's been throughout this whole episode so far has been contradictions, and it's unsettled the public.
Physician, heal thyself.